Here we are with this young man. Unfortunately, we're seeing that a lot of kids are being sent home, families are staying at home. It is his first time ozone, so we're not going to do a high dose. We're going to just do a minor dose on him. When we decide to do high doses on patients is because they have had a G6PD panel done. G6PD is to make sure that their red blood cells are able to withstand the amount of ozone going into the body. That's also a test that they do for vitamin C. But here what we're doing today is he has a viral infection going on that's just spreading like wildfire with everybody in schools and just like in general, right? So what we're going to do today is just pass a little bit of ozone through his body. So it's his own blood infused with ozone, oxygen with a third molecule. And that's going to basically reduce inflammation and kill viral, bacterial, fungal, and parasitic. So it's a simple process. We've already inserted the cannula. At this point, the syringe has a little bit of heparin in it to make sure that the blood does not coagulate. As you can see, we're going to draw 60 cc's of blood. If anything, the patient will actually have a lot of energy that day. In his scenario, because he's already sick, he's not going to have that energy. If anything, he's probably going to go take a big nap. And that's what we want the body to do, right? Go back to homeostasis. So ozone is great because we're going to be passing it through UV, UVB, and UVC light, which is going to help with killing viral, bacterial, fungal, and parasitic. In this scenario, the patient has a viral infection going on. So with that said, systemically, this ozone is going to go to the whole body and just reduce inflammation and get that virus out. So now what we're going to do is put the blood here. Very carefully, we have to insert it into sodium chloride. And now we get all the air out. Now let's go get some ozone in it. Okay, and we're gonna go put you in a comfy room. Let's go to the room on the other side. Now while we go set up for the ozone and actually ozonate the air, this is the Champion 4000. Is an ozone UV light. So that's the difference between some ozone places and others, that we do offer the light. So it goes, if you really want that, that mechanism of killing fungal, parasitic, viral, you want to have the Champion 4000. So as you guys can see, there's 4 different light bulbs in here, and it has that. So the blood is going to be passing through this, through a helix that is going to basically kill that bacteria. So here we are. Now we are with our Ozone net. This is the device that we use. There's different devices. My personal favorite is the O3 by Ozone net. So this is going to be the ozonator that's going to create that third bond of molecule to the oxygen. So here we go. This is a butterfly needle. We have the little cannula area, the tubing. We're going to put it into the IV. Carefully not to puncture the bag. I've done that before. There you go. And now we put the process. We're going to go high on the ozone, the gammas, and there we go. So for you guys to appreciate what's happening, I'm going to do this. And here you go. So here we go. Now we hang up the bag. Then we pass it through the light. If you guys want to see right there. So now it's going to be passing through there. And then we just hook it to the patient. Now everything's open. So now let's just open it up. Yeah, you want to get the blood when it's starting to pass through there. It's going to look really cool. And here we go. So if you can see, there's a helix where the blood is passing. And obviously we want to drip the patient slow so they get the most benefits out of it. And there you go.